Schizophrenia remains one of the most misunderstood diagnoses in medicine. While often confused with having a split personality, the condition actually involves a distinct set of symptoms related to how the brain processes reality. Public perception also frequently links the diagnosis to inherent violence. Statistically, the opposite is true. Individuals living with schizophrenia are far more likely to be victims of violence than to commit it. These misconceptions create a culture of stigma that breeds fear. This environment often causes families to hesitate, dangerously delaying the search for medical help during the early stages of the disease. Societal silence and the fear of a label represent the most immediate threats to a new patient, as they block the path to life-changing early intervention. Moving past the myths allows us to focus on the biological reality, the specific time frame when the condition first appears. Most patients experience their first symptoms within this specific window, between their late teens and their early 30s. This demographic timing causes maximum disruption, striking exactly when a person is meant to be transitioning into an independent adult life. Because the disease interferes with these crucial developmental years, time becomes the most important variable in determining how successful a recovery will be. Clinical research identifies schizophrenia as a strictly physical, brain-based disorder. The condition is characterized by episodes of psychosis, referred to as positive symptoms, which include hallucinations, delusions, and disorganized thinking. These coexist with negative symptoms that are often harder to spot, such as reduced motivation, a flat emotional affect, and severe social withdrawal. This chart shows the direct relationship between time and treatment. As psychosis goes untreated, the difficulty of achieving a clinical recovery curves sharply upward. Delaying treatment allows the psychosis to damage a patient's long-term prognosis, turning a manageable vulnerability into a cascading crisis. Managing that crisis requires coordinated specialty care. This approach surrounds the patient with 4 distinct pillars of clinical support. The first pillar is psychiatric intervention, which focuses on managing the necessary antipsychotic medications. The second is cognitive behavioral therapy, to help patients navigate the experience of psychosis. The final pillars provide family psychoeducation and supported employment. Together, these nodes form a protective ring that stabilizes the patient's daily life. Isolated treatments like medication are rarely enough on their own. Recovery depends on the synergy between biological, psychological, and social support. Coordinated intervention transforms the long-term outlook for this diagnosis. With early care, schizophrenia becomes a highly manageable condition. Individuals who successfully navigate that critical window frequently return to higher education, maintain their careers, and sustain deep, connected lives. A diagnosis marks the beginning of a structured management process that protects a person's potential and long-term independence. For most families, the biggest challenge is finding a team capable of coordinating this entire web of care. Coping and healing counseling provides that solution, offering a team of over 15 licensed therapists who specialize in this type of care coordination. Their practice covers every county in Georgia. Using a 100% HIPAA-compliant telehealth model, they bring specialized support to even the most remote areas. CHC provides the therapy, family education, and coordination required for recovery, while collaborating directly with outside psychiatric prescribers to ensure the medical side of treatment is seamless. They also prioritize financial accessibility. CHC is in-network with major commercial plans and accepts Medicaid for a $0 copay. Beating the critical window requires immediate action. Visit chctherapy.com or call 404-832-0102 to begin coordinating your care today.